Hello, I'm the nursing student who will be doing your exam today. First, I just want to make sure, is that okay with you? Okay, perfect. Well, I appreciate that. It will give me some good practice. So, let's see. Have you been here before? I see you filled out some paperwork, and then I just have a few additional questions to ask if that's okay. Okay. And are you comfortable right now? Okay, good. Let me know if you need anything. So let's see these questions. So, can you confirm your date of birth? Okay. And when was your last checkup? And then what are your symptoms right now? What's the reason for coming in? And where exactly is the pain located? And when do you think it actually started hurting? Okay. Have you had a fever at all? Any weight loss? Any other symptoms? What about any tenderness in your abdomen? So just kind of the pain, discomfort. Would you say the pain comes a little bit more when you're eating or after you're eating? Sometimes. And do you have any history of stomach pain or any stomach issues, GI issues? And then what about appendicitis? And then what would you say your diet is like? Do you have a lot of greasy foods? I'm just trying to see what could maybe be causing the discomfort. Okay. Any certain foods that trigger the pain? And then what about any allergies or any food intolerances that you know about? Okay. I'm going to put my gloves on next, and then we can get your vital signs. Is that okay? So first I'm going to take your temperature. I'm going to stick this under your tongue. Perfect. Just leave it there for a moment. Okay, no fever. Good. And now, let's listen to your heart and lungs. Okay, so I'm just going to place this on your chest. Okay. Just breathe for me. Yeah, good job. Just relax. Good. Okay, now your lungs. So deep breath in. Good. Deep breath in. listen for any abnormal sounds that your intestines might be making. Okay. So nothing out of the norm. So let's do actually, let me take some notes first so I don't forget. Your temperature. And then your heart. And intestines. And then now we'll get your blood pressure. So, just slip your arm right through here for me. Perfect. And then you can just relax your arm. Okay. Perfect. So your blood pressure was 120/80. I'm just going to mark that down. And that's fine, so nothing to worry about there. So I think now I'd like to examine your abdomen a bit more, since that is why you're here. Alright? So I'm going to first just take a look, see if there's any bruises or bumps, any visual issues, and then we'll go from there. So if you can just lay back for me. Perfect. And you can just get comfortable. And then I'm just going to lift your shirt up a little bit. Okay. Good. Just leave it like that. I'm just going to visually inspect. Just feel your skin. Okay. No bumps. Just take a look with my light. No bruising. Okay. Alright. Now I'm going to push on some different areas. Now obviously whenever it hurts and whenever I get to the area that's a little bit sore, just let me know, okay? Start pushing. Any pain there? Pain? Just feeling for any abnormal bumps too. Pain? How about there? No? Okay. Alright, so I'm going to just feel the 4 quadrants again. And just let me know where the pain is exactly. Right there? And I forgot to ask, did you do any workouts recently that may have caused a pulled muscle or any kind of spasm? No. Alright, so the pain is specifically right there? Okay, so I'm going to just mark that down for the doctor. And, okay, no abnormal bumps. And does it specifically seem to happen at night or in the morning? Kind of depends. other tests just to make sure everything else is okay. So I'm going to test your reflexes next with this. I'm sure you've probably seen this many times before. So I just need you to relax for me. Put your arms down on your side. Perfect. And I'm just going to tap this on various spots of your arm and see where your reflexes are like. Good. Over here. Okay, good. Now I'd like you to put your arms out like this. I'm just going to push down and just resist it. Push, 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 push. Good. Now I want you to push my hands down. Very good. Okay. Now I'm going to just move your head. So keep your head still. Just going to turn it. Good. The other way. I'm just going to push it back. Yep, just tilt it back. And then I'm going to push it forward from behind. Good. And then I'm just going to feel your lymph nodes for any inflammation. Any pain? Good. Let me make a few more notes for the doctor. Just to make sure I'm keeping track of everything. Alright. So a few more just general checks. I'm going to have you open your mouth for me. I'm just going to take a peek inside. Good. Say ah for me. And lift up your tongue. Good. Okay. And then just push your tongue down. Good. Make sure nothing strange going on. Okay. Can you open your mouth for me? Okay. Any pain or any clicking in your jaw? Okay, good. Now, do you wear glasses? Alright. When was your last eye test? Okay. So then in that case, I'm just going to do a few quick things. Again, just to make sure your health is normal, besides your stomach issues that you're having. So let me just take a quick look at your pupils. Look right here. Good. And just keep looking at my nose. Good. Keep looking. Good. Now look back here. Okay. Tell me how many fingers. Good. Good. Whoops. Good. Now look back here, right here. And how many fingers? Good. 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 And sorry, that was actually kind of tricky since my gloves blended in with my shirt. But you did a good job. I'm just going to have you look at this chart for me. I'm going to move it back right here. That should be a good spot. I'm still learning exactly where it needs to be, so I think this is good. cover your right eye. And what is the smallest line you can read? Okay, good. That's the 20/20 vision. And then cover your other eye. And what's the smallest line you can read? Very good. Okay. Also, the 20/20 vision line. Actually, I just noticed I forgot to write down, what are you taking when it starts to hurt? Okay, and do you find that that helps? Yeah, I'm sure the doctor can give you something a little bit better, especially in the meantime while we try to figure out what's going on. Alright, now I have another quick test for you. It's just kind of more of a cognition test, just to make sure everything's okay there. So I'm going to have you just look at this for me. I need you to tell me what shape this is and what color it is. Right here. Very good. I need the shape and the color. Good. How about this one? Good. And then this one. Very good. And I know my drawing is terrible. So sorry about that. Okay. And you haven't felt dizzy at all, right? Okay. Just trying to think of anything else that could maybe pinpoint what this might be. And no issues like this run in your family. Okay, so after doing this test, I honestly feel like you should probably see a GI doctor. Now obviously, since I'm still in training, I will speak with the head doctor to make sure I'm giving the right diagnosis, but after really thinking about your symptoms, I think the next step would be to have your GI tract really examined thoroughly. There's definitely something going on in there, especially since you said some foods trigger your issues. So my first thought is maybe a food allergy, maybe you have a sensitivity, and unfortunately these things can pop up over time, even though you've been healthy and haven't had them your whole life, so that's why I think it's important to get it checked. You could also see a dietitian as well. That's another thing you could do. So like I said, I will talk to the doctor before giving you a final referral. So I believe he is busy with another patient at the moment, but I can have you either wait in the waiting room or just give you a call after I speak with him. Just give you a call. Okay. And then in the meantime, I'll also ask him to prescribe a medication for your stomach that will hopefully help. And I know anytime I have stomach issues, or if I'm bloated or just ate something that maybe doesn't agree with me, papaya always helps me, papaya enzymes. And actually I do have some right here. So here's an example of ones you could take. And these are actually all clean ingredients, and they're really just for digestive support. And I usually take about 2 after dinner, so good option, and I can give you some samples. Okay? Alright, well, I'm sorry we couldn't solve the exact issue, but I really appreciate you allowing me to do this exam today. Like I said, it was really good practice for me, and I thank you for your patience. Alright? So I'm going to pass this all along to the doctor, and he'll get back to you within the next hour. Okay? Feel better soon, and I wish you the best of luck with your recovery. So thanks again, and take care.